My name is Mike Kiehl. I'm a podiatrist here in the local northern suburbs of Cincinnati. So tonight we're going to talk a little bit about some of the common foot and ankle ailments here. Some of the stuff we'll talk about are bunions, hammer toes, plantar fasciitis or heel pain, neuromas, warts, and ankle sprains. So we'll start first with bunion, also known as a hallux valgus deformity. So it's a fairly common thing that we see. And what the bunion deformity is actually it's an enlargement of the bone at the first metatarsal phalangeal joint, and that's where the first metatarsal deviates, as I said, and then causes the great toe to go towards the outside. As the disease progresses or the process progresses, usually the hammer toes and the pain get worse. Well, the first thing we look at is called the intermetatarsal angle. It's the relationship between the first metatarsal and the second metatarsal. That angle is normally 8 to 12 degrees. Some bunions, and we gauge them mild, moderate, severe based on that angular relationship. So what do we do conservatively to help these things? Well, we can do toe spacers to push the toe over. You can try a bunion splint, which pulls the toe over. Also orthotics with offloading pads in this area to take away pain, or pressure points. Goals of surgical correction with bunions include getting rid of the pain, getting a congruous joint or a joint that's in good alignment, and we want to get as much motion back at that joint as we can, and correction of the deformity. There's many procedures that can be done for bunions, and they gauge based on how bad the bunion is. One of the more common ones we do for mild to moderate bunions is called an Austin bunionectomy. So we make an incision right over the top of the joint here, and as we dissect into the joint, you can see the tendon here, and then this is the joint. We open the joint up, and you can see the first metatarsal head, and what we do once we get into this part is we remove that head from the side to get rid of part of the bump. So next we're going to talk about hammer toe deformity. That's second on the list tonight. So the hammer toe deformity is a very common thing. People get corns, calluses associated with these. So it's a deformity in which the proximal phalanx points upward, and then there's two other bones in there, two little bones. They both point downward. So when we look at a hammer toe, what are we looking at? Do you have corns or haloma dura? Do you have a soft corn in between the toes? Are there ulcerations or open sores? And the main thing we want to know is it a flexible or rigid deformity? So with a flexible deformity, treatment options include tendon lengthenings, capsulotomies where we actually go into the capsule, and sometimes we even do tenotomies where we actually cut the tendon to release the toe to come down. Third on our list tonight is a very common, probably the most common thing we see in the office, and it's called plantar fasciitis. A lot of people refer to it as heel spur syndrome. Usually patients with this complain of pain when they first stand up in the morning. So when we look at the heel, this is from the inside part of your heel. Here's your heel bone here. Your Achilles tendon is coming here. And as the nerve comes down, that's what we're checking for. We want to make sure there's no entrapment of the nerves. But usually that heel pain hurts right down in this area. So treatments, 95% of patients will get better with conservative therapy versus surgical. So that's a good thing.